Have you ever taken a medication and wondered if there could be hidden side effects you're not aware of? Medications are a crucial part of modern medicine, helping us manage pain, control chronic conditions, and improve our quality of life. However, not all medications are without risks, and some can have surprising effects on our brain health, especially when used over a long period. In today's video, we're going to uncover a shocking truth: 10 popular remedies that could potentially increase your risk of dementia. These aren't obscure drugs you've never heard of. Many of them are common medications that you or someone you know might be taking right now. From over-the-counter antihistamines, prescriptions for anxiety and depression, these medications can affect cognitive function in ways you might not expect. What makes this information even more crucial is that dementia is a condition that affects millions of people worldwide, and it's something many of us fear as we age. But by understanding the risks associated with certain medications, we can make informed decisions about our health and take steps to protect our brain function. So if you're curious about which medications might be putting your cognitive health at risk and what you can do to mitigate these effects, you're in the right place. Stick around as we dive into these 10 medications that could be more harmful than you think, especially when it comes to your memory and brain health. You might be surprised by what you learn, and it can make a big difference in your life or the life of someone you love. Let's get started. 1. Statins. Let's talk about statins, a group of medications that millions of people worldwide rely on to keep their hearts healthy. You've probably heard of names like atorvastatin, Lipitor, and simvastatin, Zocor. These are popular statins prescribed to lower cholesterol levels and reduce the risk of heart attacks and strokes. By blocking an enzyme in the liver responsible for making cholesterol, statins effectively lower the levels of bad cholesterol, LDL, in the blood, which is a big win for cardiovascular health. However, while statins are great for your heart, recent research has raised concerns about their potential effects on brain health. Some studies suggest that long-term use of statins might be linked to memory loss and cognitive issues, raising questions about their safety for the brain, especially in older adults. The theory behind this is that cholesterol is not only important for heart health, but also plays a crucial role in the brain, helping to form and maintain synapses, connections between neurons. Disrupting this balance might affect memory and cognitive function over time. It's important to note that the evidence is still inconclusive, and for many people, the benefits of taking statins to protect heart health outweigh the potential risks. If you're concerned about these side effects, talk to your healthcare provider to find the best plan for you. Your health decisions should always be informed and tailored to your need. Antidepressants. Let's dive into a type of medication that has been around for quite some time: tricyclic antidepressants, TCAs. These medications, such as amitriptyline, Elavil, and nortriptyline, Pamelor, were among the first antidepressants developed and are still used today to treat not only depression but also chronic pain, migraines, and even insomnia. They work by increasing the levels of key neurotransmitters in the brain like serotonin and norepinephrine, which can help lift mood and alleviate symptoms of depression. But there's a catch. Tricyclic antidepressants have strong anticholinergic properties, meaning they block the action of acetylcholine, a neurotransmitter that is crucial for memory and learning. This blocking effect can lead to a range of side effects, such as dry mouth, blurred vision, and constipation. More concerning, however, is the potential impact on brain health. Research has shown that long-term use of TCAs, particularly in older adults, is linked to a higher risk of cognitive decline and dementia. The anticholinergic effects can impair memory, slow down thinking, and contribute to confusion, which is especially problematic for those already facing age-related cognitive changes. If you're taking a tricyclic antidepressant, it's important to understand these risks and discuss them with your healthcare provider. Exploring newer antidepressants with fewer cognitive side effects could be a smarter option for your brain health. Proton pump inhibitors, PPIs. Let's talk about a type of medication that many people turn to for relief from heartburn and acid reflux: proton pump inhibitors, PPIs. You've probably heard of some popular names like omeprazole, Prilosec, esomeprazole, Nexium, and pantoprazole, Protonix. These drugs are incredibly effective at reducing the production of stomach acid, which can help prevent that uncomfortable burning sensation and protect against damage to the esophagus. For many, PPIs are a go-to solution for managing gastroesophageal reflux disease, GERD, and similar conditions. However, while PPIs can be a lifesaver for those struggling with chronic acid reflux, there's a side of them that isn't often talked about: their potential impact on brain health. Recent studies have suggested a link between long-term use of PPIs and an increased risk of cognitive decline and dementia. One possible explanation is that these medications can interfere with the absorption of essential nutrients like vitamin B12, which is crucial for brain function. Additionally, PPIs may alter the gut microbiota, which plays a key role in the gut-brain axis, a pathway of communication between the gut and the brain. If you or someone you know is taking PPIs regularly, it might be worth discussing these potential risks with a healthcare provider. Understanding the full picture can help you make informed decisions about your health and explore alternative ways to manage your symptoms. Benzodiazepines. Let's talk about a type of medication that many people turn to for relief from anxiety and insomnia: benzodiazepines. You might know them by some of their popular names like diazepam, Valium, lorazepam, Ativan, or alprazolam, Xanax. These drugs are highly effective at calming the nervous system, making them a quick fix for those moments of intense stress, panic, or sleepless nights. By enhancing the effect of a neurotransmitter called GABA, benzodiazepines help reduce brain activity, which can make you feel relaxed and more at ease. However, there's a side of benzodiazepines that's crucial to understand, especially if you're using them for the long term. Recent studies have linked prolonged use of these medications to an increased risk of Alzheimer's disease and other forms of dementia. This is because benzodiazepines can cause changes in the brain that interfere with memory and cognitive function. They can impair the brain's ability to form new memories and retrieve old ones, leading to a decline in cognitive abilities over time. If you or someone you know is using benzodiazepines regularly, it's essential to be aware of these potential risks. Always discuss with your healthcare provider about the duration of use and explore safer alternatives for managing anxiety or insomnia. Protecting your brain health is just as important as managing immediate symptoms, and being informed can help you make the best choices for your long-term well-being. First-generation antihistamine. Let's take a look at a common type of medication that many of us have used for allergies, colds, or even as a sleep aid: first-generation antihistamines. You might know them by their brand names like Benadryl or chlortrimetol. These medications are popular for their ability to quickly relieve symptoms like sneezing, runny nose, and itching. By blocking histamine, a substance in the body that causes allergy symptoms, first-generation antihistamines are effective at providing quick relief. However, there's a lesser-known side to these drugs that you should be aware of: their potential impact on your brain. First-generation antihistamines have strong anticholinergic effects, meaning they block a neurotransmitter called acetylcholine, which is essential for memory and learning. This blocking action can cause side effects like drowsiness, confusion, and blurred vision. But more concerning is the long-term impact these drugs can have on cognitive health. Studies have shown that frequent or prolonged use of first-generation antihistamines, especially in older adults, is associated with an increased risk of cognitive decline and dementia. This means that while these medications might help you get through allergy season or a tough night's sleep, they could be doing more harm than good when it comes to your brain health. If you're using these medications regularly, consider discussing safer alternatives with your healthcare provider. Second-generation antihistamines like Claritin, loratadine, or Zyrtec, tyrosine, are less likely to affect cognitive function and might be a better option for you. Protecting your brain health is crucial, so make sure to stay informed and choose the best option for your long-term well-being. Anticholinergics. Let's talk about a group of medications that might be hiding in your medicine cabinet without you realizing their potential impact on your brain health. Anticholinergic. These drugs are commonly prescribed for a wide range of conditions, such as overactive bladder, allergies, depression, and even Parkinson's disease. You might know some of them by their names, like oxybutynin for bladder issues, or diphenhydramine found in many allergy medications and sleep aids. Anticholinergics work by blocking the action of acetylcholine, a neurotransmitter that's crucial for many bodily functions, including memory, learning, and muscle control. While these medications can be effective for managing symptoms, there's a hidden downside that isn't often discussed. Blocking acetylcholine can have serious effects on the brain, particularly when these drugs are used over long periods. Research has shown that prolonged use of anticholinergic medications can increase the risk of cognitive decline and dementia. Especially in older adults, these drugs can impair memory, reduce the ability to learn new information, and slow down thinking processes, making them particularly concerning for those already at risk for cognitive issues. If you're taking an anticholinergic medication, it's crucial to understand these potential risks and talk to your healthcare provider about safer alternatives. Staying informed about your medications and their effects can help you make the best choices for your brain health and overall well-being. Don't let hidden side effects catch you by surprise. Protect your brain by being proactive about your medication use. Corticosteroids. Let's take a closer look at a powerful class of medications known as corticosteroids. You might know them by names like prednisone, dexamethasone, hydrocortisone. These drugs are often prescribed to reduce inflammation and suppress the immune system, making them incredibly effective for treating a wide range of conditions, from asthma and allergies, autoimmune disorders, and skin conditions. When used correctly, corticosteroids can be life-changing, bringing relief from pain and inflammation that might otherwise be debilitating. However, there's a side to corticosteroids that isn't often discussed: their potential impact on brain health. While they are highly effective in the short term, long-term use of corticosteroids has been linked to cognitive issues, including memory loss, mood changes, and even an increased risk of dementia. How does this happen? Corticosteroids can cause structural changes in the brain, particularly in areas like the hippocampus, which is essential for memory and learning. These changes can lead to cognitive impairment and emotional disturbances, affecting your overall quality of life. If you or someone you know is using corticosteroids for an extended period, it's crucial to be aware of these potential risks. Always discuss with your healthcare provider the duration and dosage of your treatment and explore alternatives when possible. Being informed about the potential side effects can help you make the best decisions for your brain health and overall well-being. Sleep aids. Let's talk about a type of medication that many people reach for when they're struggling to get a good night's sleep. Sleep aids. Whether it's over-the-counter options like diphenhydramine, found in Benadryl or Tylenol PM, or prescription medications like Zolpidem, Ambien, and Esopiclone, Lunesta, sleeps are widely used to help people fall asleep faster and stay asleep longer. For those dealing with occasional insomnia or jet lag, these medications can seem like a lifesaver. However, there's a hidden side to sleep aids that you need to know about, especially if you're using them regularly. Recent research has raised concerns about the long-term use of these medications and their potential impact on brain health. Some studies suggest that frequent use of sleep aids, particularly in older adults, may be associated with an increased risk of cognitive decline and dementia. This is because many sleep aids have anticholinergic effects, meaning they can block a neurotransmitter called acetylcholine, which is crucial for memory and learning. If you or someone you know relies on sleep aids regularly, it's important to be aware of these potential risks. Consider discussing alternative strategies for improving sleep with your healthcare provider, such as cognitive behavioral therapy for insomnia, CBTI, or lifestyle changes. Taking steps to protect your brain health now can help ensure better cognitive function in the future. Antipsychotics. Let's talk about a powerful class of medications known as antipsychotics. These drugs, including names like risperidone, Risperdal, and olanzapine, Zyprexa, are primarily used to treat serious mental health conditions, such as schizophrenia, bipolar disorder, and severe depression. By altering the effects of neurotransmitters in the brain, antipsychotics can help manage symptoms like hallucinations, delusions, and severe mood swings. making a huge difference for those who need them. However, there's a side to antipsychotics, often goes unnoticed, especially when they're prescribed to older adults or those without serious psychiatric conditions. Recent research has shown that long-term use of antipsychotics can have serious side effects on brain health. These medications have been linked to an increased risk of cognitive decline and dementia, particularly in older adults. Antipsychotics can cause sedation, alter brain chemistry, and sometimes even shrink certain brain regions over time, affecting memory, thinking, and judgment. If you or someone you care about is taking antipsychotics, it's essential to understand these potential risks. Always talk to your healthcare provider about the necessity and duration of use. Explore other treatment options if possible. Protecting brain health is crucial, especially as we age, so staying informed about the effects of these powerful medications can help you make the best choices for long-term well-being. Over-the-counter cold medications. Let's talk about a common go-to for many of us when we're feeling under the weather. Over-the-counter cold medications. These remedies, found in nearly every medicine cabinet, include familiar names like NyQuil, Dayquil, and Sudafed. They're great for temporary symptoms like congestion, runny nose, and cough, helping us power through the day or get a good night's sleep when a cold strikes. However, there's a hidden side to these medications that isn't often discussed. Many over-the-counter cold medications contain first-generation antihistamines or decongestants, which can have strong anticholinergic effect. This means they block the action of acetylcholine, a neurotransmitter that plays a crucial role in memory and learning. Over time, especially with frequent use, these effects can impair cognitive function, slow down thinking processes, and even increase the risk of dementia in older adults. While these medications can provide short-term relief, it's essential to use them cautiously, particularly for older individuals or those with concerns about brain health. If you rely on these cold remedies often, consider discussing safer alternatives or non-medication options with your healthcare provider. Protecting your cognitive health is important, and being aware of what's in your medicine cabinet can help you make better choices for your long-term well-being.